Okay, we're going to get started. So we're going to hand it over to Brenda to lead this panel, which I think will be a fantastic complement to what we've learned earlier today about the deep experiences of public-private partnership and the enabling environment in both Kenya and the Congo. So this panel will focus on Becton, Dickinson and Company's experience establishing a public-private partnership in India. So Brenda, handing it over to you.
So thank you, everyone. We have somewhat of the disadvantage of going last, but the advantage of going last in the sense that hopefully we can build on some of the things that we've heard earlier today and have this panel provide more information and add to the robust knowledge base that we've had so far during the discussion today. So today's panel discussion will focus on a partnership between Becton Dickinson, or BD, as I know them, USAID, and the government of India. It's called STRIDES, and it stands for Strengthen, and I have to say this because I actually like this, Strengthen TB Resistance Testing and Diagnostic Systems. It's a mouthful, but you'll see why it needs a robust title because it's such a robust partnership. I'm going to introduce our representative from BD as well as our representative from USAID in a minute. I just want to mention that unfortunately, Dr. Nishant Kumar from the government of India was unable to join us today. So we're still going to try to get the government perspective in this conversation, and I'll rely on both Renuka and Amy to help us do that. So let me introduce our esteemed panelists. Renuka Gade, who's a longtime friend of mine. Renuka is Vice President for Global Health at Becton Dickinson and Company, or BD. Her responsibilities include extensive external engagement with ministries of health, international agencies, and non-governmental organizations, as well as significant internal engagement across BD's units, geographies, and functions, all in support of strategies, products, and programs that advance equitable access to health for all people. So she doesn't have a hard job at all. Also, a new friend now, having met Amy today, Amy Pitek, who since 2009 has held the position of Senior Tuberculosis Technical Advisor at the United States Agency for International Development, or USAID, in Washington. Amy has led the TB laboratory and diagnostic strategic planning and implementation for USAID country, regional, and global programs, including 23 high burden and priority TB countries. Her current work focuses on improving the uptake of TB diagnostics in countries by strengthening and integrating quality diagnostic networks. Yet another person with an easy job. So just a little bit about the format today. I'm going to ask both panelists to spend a few minutes giving a brief overview of their perspectives. Amy will basically focus on, why does this matter? What is TB? Why is TB such an important issue? And what is the basis for this partnership? Why is it so important? And then I'll ask Renuka to spend a little bit of time speaking about the objectives of STRIDES, of the partnership itself, and BD's motivation behind that. We're then going to kind of switch to more of a fireside chat format, absent the big comfy leather chairs and the fire, because that would have been a problem. But we will move to that format, and I'll tee up some questions to both panelists that focus on different aspects of the partnership, whether it be governance, the enabling conditions, challenges, et cetera, that help to implement and drive this PPP. And then finally, we'll turn it over to the audience to see if there are questions that our panelists can address. So with that, I'm going to turn it over to Amy to tell us a little bit more about TB and why we should be paying attention to it.